Hello, welcome back to Dr. Hayatu Medical Session. Today we'll be discussing an important topic, cholelithiasis. If you've ever wondered about the causes, symptoms, and treatments for this condition, you're in the right place. Don't forget to subscribe to our channels and ring the notification bell to stay updated on our health content. Let's get started. Cholelithiasis is a medical term referring to the presence of gallstones in the gallbladder or bile ducts. These stones can vary in size and composition, ranging from small, sand-like particles to larger solid formations. They are formed when substances in bile, such as cholesterol or bilirubin, become too concentrated and crystallize. The common cause of cholelithiasis is the imbalance in the substances that make up bile. This imbalance can lead to the formation of gallstones, which are typically made of cholesterol, bilirubin, or a combination of both. Other factors that can contribute to the development of gallstones include obesity, rapid weight loss, certain medications, genetics, and certain medical conditions such as diabetes and liver disease. The sign and symptom of cholelithiasis is typically abdominal pain, especially in the upper right portion of the abdomen, which can be severe and may radiate to the back or right shoulder blade. Other symptoms can include nausea, vomiting, bloating, indigestion, and intolerance to fatty foods. In some cases, cholelithiasis can lead to complications such as inflammation of the gallbladder, pancreatitis, cholangitis infection, and inflammation of the bile duct, usually resulting from a blockage caused by gallstones, which can cause jaundice and fever. Investigation modalities of cholelithiasis include imaging tests like ultrasound, which is often used as the initial investigation for suspected gallstones because it is non-invasive and can detect the presence of stones in the gallbladder or bile ducts. Blood tests may be performed to assess liver function and check for signs of inflammation or infection. A computed tomography (CT) scan may be used to provide more detailed images of the gallbladder and surrounding structures, particularly if complications such as inflammation or blockage are suspected. Magnetic resonance cholangiopancreatography is a specialized MRI technique that focuses on imaging the bile ducts and pancreas. It can be useful for evaluating the anatomy of the bile ducts and detecting any obstructions caused by gallstones. In cases where further evaluation or treatment is needed, endoscopic retrograde cholangiopancreatography, ERCP, may be performed. This procedure involves the insertion of a flexible tube through the mouth and into the bile ducts to visualize any abnormalities and, if necessary, remove gallstones. The management of cholelithiasis depends on several factors, including the presence of symptoms, the size and number of gallstones, and any associated complications. Here are some of management strategies. Observation. If gallstones are discovered incidentally and are not causing symptoms, a watch and wait approach may be recommended. Regular monitoring through imaging tests and symptom assessment can help determine if further intervention is necessary. Medications. In some cases, medications such as ursodeoxycholic acid, ursodiol, may be prescribed to help dissolve cholesterol gallstones, particularly in patients who are not suitable candidates for surgery. Surgery. Cholecystectomy, or surgical removal of the gallbladder, is the most common treatment for symptomatic gallstones. This can be done using minimally invasive techniques such as laparoscopic surgery, which typically involves smaller incisions and shorter recovery times compared to traditional open surgery. Endoscopic procedures. In cases where surgery is not possible or preferred, endoscopic techniques such as endoscopic retrograde cholangiopancreatography, ERCP, with sphincterotomy may be used to remove gallstones or relieve biliary obstruction. The choice of management depends on various factors, including the patient's overall health, the severity of symptoms, and the presence of any complications. It's essential to discuss the options thoroughly with a healthcare provider to determine the most appropriate course of action for individual cases. Lifestyle modifications that can help manage cholelithiasis include maintaining a healthy weight through a balanced diet and regular exercise. Consuming a diet rich in fruits, vegetables, drinking much water helps keep bile fluid and can help prevent the formation of gallstones. High-fat foods can trigger gallbladder contractions and increase the risk of gallstone symptoms. Limiting the intake of fatty foods, fried foods, and processed foods may help reduce symptoms. Excessive alcohol consumption and smoking can increase the risk of gallstones, so it's important to drink alcohol in moderation and avoid smoking to reduce the risk. These lifestyle modifications are not only beneficial for managing cholelithiasis, but also for overall health and well-being. However, it's important to consult with a healthcare professional before making any significant changes to your diet or lifestyle, especially if you have existing medical conditions. If you found this information helpful, subscribe for more health-related content. Thanks for tuning in, and until next time, stay healthy!